Orserdu is used to treat certain types of breast cancer. Active ingredient Elacestrant. Breast cancer cells need the hormone estrogen to grow. Orserdu is from the class of drugs called a selective estrogen receptor downregulator. Elacestrant works by blocking the effect of estrogen, slowing or stopping the growth of cancer cells. How to use? Orserdu is a tablet that is taken once daily at about the same time each day. Swallow the tablet whole, do not chew, crush or split the tablets before swallowing. Don't take any tablets that are broken, cracked or that look damaged. Take Orserdu with food as this may help reduce nausea and vomiting. If you mistake your tablet or vomit after taking a tablet, don't take another tablet on that day. Skip the dose and take the next dose the following day at your regularly scheduled time. Take this medicine exactly as your healthcare provider tells you. Do not change your dose or stop taking this medicine unless your healthcare provider tells you. Orserdu dose reduction levels for adverse reactions. First dose reduction, dosage 258 mg once daily, 386 mg tablets. Second dose reduction, 172 mg once daily, 286 mg tablets. Contraindications. Before taking Orserdu, tell a healthcare provider about all of your medical conditions, especially if you have liver problems, are pregnant or plan to become pregnant. Orserdu can harm your unborn baby. Precautions. Before taking Elacestrant, tell your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Orserdu may interact with prescription and over-the-counter medicines, vitamins and herbal supplements. It is important to tell a healthcare provider if you take any of these products. Orserdu and other products may interact with each other, causing side effects or changing each other's effects. Side effects. Serious side effects of Orserdu include increased fat, lipid blood levels, hypercholesterolemia, increased triglyceride blood levels, hypertriglyceridemia. High triglyceride and lipid levels in the blood can increase your risk of heart attack and stroke. Your healthcare provider will do a blood test to check these levels before starting treatment and during treatment. The most common side effects of Orserdu includes muscle and joint pain, increased kidney function test, nausea, reduced appetite, increased cholesterol and triglyceride blood levels, diarrhea, headache, increased liver function tests, constipation, tiredness, stomach area, abdominal pain, reduced red blood cell counts, hot flash, vomiting, heartburn or indigestion, decreased sodium levels in your blood, reduced fertility in males and in females who are able to become pregnant.